name is Oni AB. Hey, welcome to Ruzu Holistic TV. Today I'll be educating you on diabetes. Let's start with what is diabetes. Now, diabetes is a metabolic disease that causes high blood sugar. It is a disease that affects the body's ability to produce the use of insulin. What is insulin? Insulin is a hormone that helps the body turn the food you eat into energy. Now, there are different types of diabetes. We have the type 1 diabetes, we have the type 2 diabetes, and we have the gestational diabetes. The type 1 diabetes occurs when the insulin producing cells of the pancreas are destroyed by the immune system. Now, people with type 1 diabetes produce no insulin and must use insulin injections. That is why you see some people, they go to the pharmacist to buy insulin injections. These are people with type 1 diabetes. Now, type 2 diabetes. People with type 2 diabetes produces insulin, unlike people with type 1 diabetes. But however, the insulin their pancreas secretes is either not enough, or the body is unable to recognize the insulin and use it properly. When there's not enough insulin, or the insulin is not used as it should be, the glucose can't get into the body cells. That's for type 2 diabetes. Now, gestational diabetes. Gestational diabetes is as a result of pregnancy. It actually happens to pregnant women alone. Now, this is triggered by pregnancy. Hormone changes during pregnancy, and it can affect insulin's ability to work properly. Symptoms of diabetes. There are different symptoms of diabetes. It includes increased taste, increased hunger, especially after eating, dry mouth, frequent urination, unexplained weight loss. You see people with diabetes and they will just, somebody is fat today, tomorrow, fatigue, blood vision, you won't be able to see clearly. It affects the eyes. Heavy breathing, loss of consciousness. Now, for type 2 diabetes, it has its own symptoms. It might include slow healing of sores. That's when you have an injury, it takes time to heal because of type 2 diabetes. Itching of the skin, usually in the vagina. Yeast infections, recent weight loss, numbness or tickling of the hands and feet. Then impotency, that is for men, which is erectile dysfunction. Now, how can you manage diabetes? How can we manage diabetes? The goal of managing diabetes are to keep your blood glucose level as near to normal as possible by balancing food intake with medication and activities. 2, control your blood pressure. That is, always check your blood pressure. That is the BP. Don't allow it to go above 130 to 80. Possibly prevent the development of diabetes-related health issues. Maintain your blood cholesterol levels as near their normal ranges as possible by decreasing the total amount of fat to 30% or less of your total daily cholesterol or calories by reducing saturated fats and cholesterol. Now, you manage diabetes by planning what you eat and following a balanced meal plan. You don't eat anyhow. You make sure you eat balanced diet. You exercise regularly. Now, exercise will help you keep fit. It will help you reduce cholesterol in the body and calories. Taking medicine, monitoring your blood glucose and blood pressure levels at home, keeping your appointments with your healthcare providers, and having laboratory tests as ordered by your doctor. So always check your BP, check your sugar level. Some people will stay for more than 1 year. They don't even know their sugar level. You will ask somebody who knows he or she has BP, when last did you check your BP? Say, I can't remember, 1 month ago. It's not good. You're supposed to check your BP daily, or at least 3 times a week. Or you buy the BP apparatus, keep it in your house so you can often check whenever you want to check, so you won't be caught unawares. It's very dangerous. Now, causes of diabetes. We have pancreas unable to make insulin. Like I said earlier, that insulin is an hormone that helps to change the food you take to energy. Now, pancreas makes little insulin. When your pancreas produces little insulin, of course, it won't be enough for your body. So it leads to diabetes. When your body doesn't respond to insulin, other factors that causes diabetes includes high blood pressure, high fats and carbohydrates diet. When you have, sometimes diabetes can be generational, when you have diabetes in your family or your family is known for diabetes. And now you know this, and you take lots of carbohydrates, sugar, fat, you don't control what you eat. It's very dangerous. High alcohol intake, sedentary lifestyle, obesity, gestational diabetes, or giving birth to a baby weighing more than 9 pounds can also cause diabetes. And of course, age. Diabetes comes with age. People above 40 are at risk of having diabetes. Your body can actually forgive you you can eat anything when you're 1 year to 25 years. You can eat anything, fine, your body will forgive you. From 25 years upwards, you have to control what you eat, because anything you start taking into your body after 25 years counts for you, and at the later it might affect you. Now, finally, what is the solution? You have diabetes, what can you do? Can diabetes actually leave you? Does diabetes have a cure? What's the answer? The answer is yes. Diabetes has a cure. It cannot only be managed, but it can also leave your body. Now, what is the cure for diabetes? Ruzu Herbal Dye Care is the cure for diabetes. Where can you get Ruzu Herbal Dye Care? In any pharmacies close to you, or if you're in Abuja, you can come to Suite B29 Discovery Mall, opposite Eco Bank, Wuse 2. You can also join us where we'll be talking about how to keep your body healthy and free from sicknesses and diseases. We'll also give you solutions to your health issues. You can actually come with your problems, your sicknesses, ask questions. Ruzu Holistic Healthcare Center is here to serve you better. Thank you.